Alright, see, don't concentrate on the phone of this. You just concentrate on what we are doing now. First and foremost, we are going to start. We start from we start our first lecture when you resume work was drugs. So we are going to be talking about drugs. You get? This is our topic. So, what is drugs now? Yes, I'm coming.
Drugs are any chemical substance.
So the answer would be drugs.
Are any chemical substances that when taken into the body alters its function, either physically or psychologically.
Alright, okay. Drugs are any chemical substances that when
taken into the body alters its functions. Either physically.
Okay.
Or psychologically.
Physically or psychologically. So now we have the definition of drugs. We talk about the classes of drugs, right?
Yes.
And then which one is the first classes of drugs? Which one is the first one? The first
analgesic.
So we talk about analgesic, and then what I said is analgesic.
Analgesic drugs are the drugs that when taken into the body, it cures or reduces the sensation of mental loss of consciousness.
Okay, our classes of drugs that block the sensation of
pain without loss of consciousness.
Without loss of what?
Consciousness.
Without loss of consciousness. So let's quickly analyze this thing. You get? Let's quickly analyze the explanation using. Let's explain this thing. Explanation using the diagram for an example. You get? So we have to explain this thing using a diagram. You get? So we have to use diagram to explain what this particular place is trying to tell us. For an example, let's assume we have something like this. So this is the eye. This is the facial diagram. So we now have something like this. You get? That we assume that is the brain. This is the brain. So we assume that this is how the brain looks. Now this thing is the brain. Let's assume this is the brain. You get? So this is the brain. So since we have assumed that this is the brain, why this place is the eye, then this one is the nose, and then everything. So let's assume this place now is the one that we assume as well that this is the medulla. You can call it medulla oblongata. You get? This is the medulla oblongata. Then this one is the central brain. You can call this one cerebellum. See, I will ask you this question later. This one is the cerebellum. Are you getting the point? This is the cerebellum. Then this one you can call it what? Cerebrum. So this one is what?
Cerebellum.
This one is what? Cerebellum. This one is what? Medulla oblongata. For example, we already have this thing. Then let's assume we bring out this brain from this place that is this to this place as well. You get? Bring it to this place and then we have something like this. Now have something like this. something like this. So as the brain, this is our new brain, and you have also, and I will try as much as possible to cover out. Then this place is known as the cerebrum. So this is the space that the medulla, sorry, this is the space that that define the whether you are feeling pains, because this place give us another way to spinal, the spinal what? Oh. So if you must feel a pain now, something happened to this particular place. I getting the point. So just assuming we have our analgesic drugs, that this is the drugs. We have the analgesic drugs. We have something like this. You get this thing is fading. You get this is the analgesic drugs as well. This is the analgesic drug, any type. So let's go. That's assuming this one is our analgesic. Get these are our analgesic drugs, and then we name it here analgesic medication. Analgesic medication. So you now take this guy, this particular guy here, this particular hormone or audio. You try to take these analgesic drugs. So when you take it, swallow it through the stomach. Fine. Then the stomach take it back to it stay on the stomach, and then the pancreas. No, I talk about the pancreas the other time. So keep on doing something by trying to filter out the nutrient, and then take it, flush it, make sure that it gets to the vein. That the vein is our major target. So when you get to the vein will be like take it to the heart. Why the heart pump? If you get to one vein, the vein will be like take it to the heart, and when the heart is pumping the nutrient, it go to the brain. And what it does is, let's assuming this place is the one used to feel pain. This one, let's assuming a vein is actually following this place, tiny vein like this, and that vein is the one that transport pain to this place, to this medulla, my G here. So when it transports, it's the one that normally transport the pain. You're like, oh, my body don't weak. So what the drugs, what this analgesic will do, which is there are class of drugs that block the sensation. They will just go there and block the way it pains you. I mean the sensation of pain, without you not fall asleep, without you know loss of any consciousness at all. You get? So that is just a simple explanation. That is, when you take this particular thing, what it do is that it goes to the, make sure that it blocks the sensation of pain in your brain, not any other places, so that you won't be able to process that activities known as pain. Yes, what you call neurons and neurotransmitters. They are based on the brain. Neurotransmitter is one that quickly transfer pains from what is the, like you pitch, I pitch, you know, like man pitch this particular boy, this guy to get long lips, man drag him. You can't go in drag, the lips come pain him. Come listen, the guy, this thing they pay me. This thing they pay me. What this thing is actually trying to explain is that immediately there's what is the neurotransmitter actually comes into assist, do some little work by transferring the pain to the medulla oblongata, whereby take it to the necessary place needed. And before you know, like this thing they pay me. If we even injure this guy, one be like, no see as you try this thing, just now, just injure me, just see they pay me. So immediately the person will take drugs, either antibiotics or this particular analgesic. What you go to do is just go to the sensation of pain, may you block that brain, may you not hear any pain again. I get to the point now. So if that is the case, what we said are examples of this what analgesics. I'm coming.
Examples of paracetamol.
There are what?
Paracetamol.
Paracetamol. Paracetamol is otherwise known as
acetyl salicylic acid.
Paracetamol. Then acetyl salicylic acid is 2. You get the next number. Paracetamol is otherwise known as you can abbreviate it to BC. If I say alpha, bring this from there. Just know that I'm talking about paracetamol. Then acetyl cyclic acid, which is no pain. That's when known as no pain. I want to feel pain. Then we have number 3, ibuprofen. And then after ibuprofen, there's one funny name. Not ibuprofen, it's naproxen. Like this. So this naproxen also look like this ibuprofen. I think we have another one. What is it?
Not NSAIDs.
NSAID.
Yes.
And NSAID drugs. What is the full meaning of this NSAID?
Non-steroidal anti-inflammatory drugs.
Non-steroidal anti-inflammatory
drugs.
You get? So these are what you need to understand about the drug itself and the classes of drugs. We just talk about analgesic. In our next lecture, we'll be talking about, we'll be explaining in details about the antipyretic before we proceed further to anti-inflammatory. You get the point, so we are done for today's lecture. Let me quickly ask a little question. Fine. What do they mean? Assuming, okay, first and foremost, what is analgesic drugs? Who can help us with analgesic drugs?
So,
Okay.
analgesic drugs are the drugs that block the sensation of pain without loss of consciousness.
Without loss of consciousness. I mean, not be say you fall asleep, you just all of a sudden you just hear say the pain don't go. You get it because you block the sensation of pain. Just go there and block the sensation of pain. You will not be able to feel pains again. So that is the meaning of that one. So we are closing for today. Maybe probably tomorrow we'll still try as much as possible to bring another new lecture. You get, so that is all.